with the North West Norfolk MP, James Wild, who joins us now. Morning, James. Thanks for joining us.
Morning, Chris.
Have you got your Christmas plans sorted yet? Are the Wilds all getting together at Christmas?
That's something we'll have to talk about now that these new rules have been set out. I think it's a good thing that people will be able to get together for Christmas. But as the Prime Minister said, it's a season to be jolly careful and think about if you've got vulnerable family members, whether it's right to meet up with them. But I think giving families the freedom to decide this is a sensible way to do after what's been an incredibly tough year.
We've heard from some members of the SAGE committee who are saying that this will inevitably, they think, lead to a spike in cases. But I think this is a key point, isn't it? If you are going to meet up with your family over Christmas, it is not without risk. It is a bit of a gamble.
Exactly. Nothing is risk-free. But I think we've got to recognise Christmas is a time when people do come together. And after such a tough year, if we can do it and people are sensible, you had the Norfolk and Norwich on earlier talking about prevention measures you can take in terms of being ventilated and taking care around vulnerable people. Then being sensible, I think we've got to trust people, and they know what's best for their family, and they're not going to put their family at risk.
There are a lot of rules to go through, though, aren't there? A lot of guidelines around this. Do you think that the risk there is that people could get quite confused by it and maybe not take the time to read them all?
Well, I think there's a bit of time, isn't there, before these rules come into effect. I mean, it's 3 households. If you're in a support bubble with someone who lives on their own, then that counts as your one household. So I think if people take a little bit of time to have a look at them, I think they're relatively straightforward. I think your guru has been answering the questions that people have had relatively easily this morning. So, and as more questions come up, I'm sure they'll be answered. But I think the general principle of three families within groups within the bubble, households within the family bubble, is fairly straightforward.
That's Christmas. Of a more immediate concern is what happens after the end of this lockdown and which tier Norfolk will be in. Now, we've been looking at the figures, and Norfolk remains among the lowest places in terms of rates of infection across the country, which lots of businesses are hoping in Norfolk will be enough to take us into Tier 1. There's a lot of speculation, actually, that nobody is going to be in Tier 1 and that every area of the country will at least be in Tier 2. What can you tell us this morning? What's your understanding?
Well, I mean, you're right. The rates in Norfolk are below the national average, although that's not to say that they aren't higher than the trigger for going into the higher tier before we went into the national lockdown restrictions. The points I was making to the Health Minister yesterday were precisely that Norfolk's got a lower average than other parts of the country, and that we should be treated as a county rather than grouped with the rest of the east of England, and we should be in the lowest tier possible that's consistent with minimising the transmission rates. They're going to be looking at the latest data is going to be available tomorrow, and that's when the decision will be made. So we wait and see what comes forward. I obviously want us to be in the lowest tier that is sensible for the area and the situation.
What did the Health Secretary say to you when you put forward Norfolk's case?
Well, he noted what I said, and obviously said that they've set out the five data points that they'll be looking at in terms of the overall infection rate, the particular levels for over 60s, and the other measures and the rate of increase or decrease they'll be looking at and taking all of that into account. I think it's obviously important that we don't want to come out of national restrictions and then go into a tier which then sees the rate suddenly increase and then it's stop-go for businesses. I think that would be bad, but I recognise if we go into Tier 2, that's going to be very damaging for the hospitality sector, who've already struggled very badly through this situation. And obviously coming into the Christmas period would be a period when they would be making money. So I want to see us in the lower tier, but those decisions will be taken in the next 24 hours or so.
Of course, it's not just about transmission rates, is it? We've already spoken to Erica Denton from the Norfolk and Norwich, who talked about the number of people they have got in hospital at the moment, and she says she expects to see more over the next few weeks. Does that actually count against the idea of Norfolk being in Tier 1? Does that mean we're more likely to be Tier 2?
Well, that's one of the factors that's being looked at, the impact on local hospitals and health services. And I didn't want to go into the national restrictions. I wanted to stay in the tiered approach. But it was the data that I saw from the Queen Elizabeth Hospital and Norfolk and Norwich and the other hospitals across the county, which persuaded me we needed to do this. And you're right to make the point. And yesterday there were 608 deaths were announced, which is incredibly sad and the highest figure, I think, since back in May. There's obviously a lag between the case infections and the deaths that happened. But it's still a very serious situation. So it's right that the latest possible data is looked at before a decision is taken. And then I and the other Norfolk MPs will obviously have to consider the decision that the government proposes.
Do you think this lockdown has worked then? Because we could be in a situation where some businesses have been told they've got to close for a lockdown and then come out of it and actually have tighter restrictions than they had before the lockdown.
Well, there's been a 30% reduction in the case rate week on week on the latest figures from yesterday. So, yes, the restrictions have had an impact. We've seen in West Norfolk the rates were picking up and have begun to level off as a result of the restrictions. So I think on balance, it was necessary to do this, but we've now brought R down to nearly 1, and that's when it's right to go back into the tiers where the controls reflect the local situation on the ground rather than having this sort of more blunt approach. But I'm in no doubt about the damaging impact that all of these controls have on businesses, on people's well-being, and that's why it's going to be a bit of a longer slog, but there's positive news potentially with vaccines and treatments, as Norfolk and Norwich were talking about, which mean that if we look towards the spring and to Easter, that could be a time where we're getting back to a proper normality in terms of life, but that is still a fair distance away. So we've got to keep following the rules in order to prevent another spike happening.
We've got people who run businesses in Norfolk, particularly in the hospitality sector, who we've spoken to, who might be listening now, who are banking on being in Tier 1 when it's announced tomorrow. That's what they want. What is your message to those people who run Norfolk businesses?
Well, I completely understand where they're coming from, and I'm talking to them every day, and I want us to be in the lowest tier possible. As I say, it's going to depend on the data, and hospitalisations is an important point, as is the rate of transmission and whether it's out in the community as opposed to being contained in certain workplaces. So all of those decisions, it's not easy, all of that data is going to be weighed in taking this decision. And if we're in a higher tier, then I'll continue to make the case for financial support for those businesses that are affected through no fault of their own, who've also spent considerable amounts of money and taken time to get COVID secure and make pubs and other places as safe as possible. So I completely understand their incredible frustration and despair in some cases as well.
North West Norfolk MP James Wild, thank you very much for joining us live on the programme this morning.